For more, joining us live now is Singapore-based journalist Adam Hancock. And I appreciate your time. Firstly, just give us a bit of a sense of what the current COVID situation is there in Singapore. How many cases are you recording there daily? What are the hospitalisation and the death rates like?
Yeah, so we are reporting around about between 3,000 and 4,000 cases a day at the moment, which for Singapore is very high, and it's the highest it's been throughout the pandemic. But to caveat that, we have got very strong coverage from vaccinations. So around about 84% of the population are now double dosed, and we're already rolling out boosters here as well. But we have seen an increase in hospitalizations and sadly deaths as well. So yesterday, I think we recorded 10 deaths. The day before that was 14. It's been double digits for a couple of days now. It was single digits before that. We are seeing a little bit of concern about the healthcare system here as well. There were reports in the local press that the number of ICU beds in the country is starting to reach a bit of a critical level. There were some reports that there were around 60 beds left, although the government did clarify that that can be scaled up. But there are concerns, and some healthcare workers have reported that they are under immense pressure within hospitals at the moment. So even though we are seeing a lot of cases and we have got good vaccine coverage, it doesn't mean that the hospitals aren't under pressure. Now, the government is trying to encourage people not to go to hospital unless they really need to. One of the biggest issues when cases started rising here was that people were turning up at hospital with not really any symptoms or very, very minor symptoms, and therefore putting additional strain on A&E departments. So the home recovery program, as the government calls it, is really designed to sort of relax people, help them to recover at home, and try and take the pressure off the healthcare workers. But at the moment, yeah, a lot of cases, and despite being in semi-lockdown conditions, we aren't really seeing numbers drop at the moment.
And when it comes to that vaccination rollout, it's great to hear you've got such a high double vaccination rate at the moment. How did Singapore get to that point? Have vaccines been mandatory for workers there?
So in certain industries, they have been made mandatory. They also did a very targeted rollout as well. So obviously the seniors were the first in line, along with healthcare workers. And then they went for people who really have public-facing roles, for example, taxi drivers, bus drivers, people working in ports. We have a large number of migrant workers who live in dormitories here in Singapore. They have all been vaccinated as well. So the rollout was very efficient. It took a little bit of time to get to the general population, particularly younger people. But once they got the supplies, I think they got a boost of Pfizer supplies. The rollout really did speed up, and it was very impressive. And now, again, the boosters are coming out. I think we're at 13% already of people who have had boosters. I imagine they'll get round to a large proportion of the population very soon. It's going to open up to over 30s once they reach 6 months after their second dose. So it's been an impressive rollout. It's something that Singapore is very good at. The only sticking point has been that a lot of elderly people here are refusing to be vaccinated. Now, the government is struggling to know what to do with them. They have tried to restrict unvaccinated people. So, for example, if you're unvaccinated now, you can't go to a shopping mall, you can't go to a restaurant, you won't be able to travel. There's a lot of testing requirements placed on you. But for a lot of elderly people who, they won't travel very much, they won't go to restaurants, that isn't going to put them off too much. And you do have to think that unless vaccines are mandated, then we're still going to see a large proportion of elderly people unvaccinated. And unfortunately, they are the people who are predominantly ending up in hospital and dying.
Adam, I know a lot of us here in Australia are very keen to pop up to Singapore when we can, and it's now not too far away. Just how picky has Singapore been in terms of deciding which countries' residents they're going to allow to enter? And is it only double vax travellers who will be allowed in, or is it just that negative test requirement at this stage?
Yes. So it's for the vaccinated travel lanes, which is what has been announced with Australia. You've got to be double jabbed in order to be able to use that. We have, I think, 11 at the moment vaccinated travel lanes. The first one was with Germany. That was open for, I think, about a month and a half before some more were announced with the UK, with Spain, with the US. There's going to be one with Korea, which will be the first Asian country, and obviously Australia as well. They have been quite selective. So to begin with, before the vaccinated travel lanes, we were only really allowing entry without quarantine, at least, to people coming from countries where COVID cases were kept very low. For example, people have been able to come from China, New Zealand, Australia for a long time were also on that list. But now with the vaccinated travel lanes, they're looking a lot more at vaccination rates. They're looking at levels of testing in countries, whether or not they can trust the testing. So they have been quite picky. I suspect we will see a lot more vaccinated travel lanes over the coming months. I think it's going to be the future of travel into Singapore for a while. And it's no surprise, really, to see that the arrangement has come in with Australia. They've always been quite welcoming to Australia, aside from the recent spike when some quarantine measures were imposed. But yeah, a lot of people were expecting it, so it's not really come as a shock here.
And just finally, tourism sectors, as we know, all around the world have been decimated. What's the sector like there? Is it ready to go? Is it everything that tourists love about Singapore still sort of there, ready to open? Or will we notice some changes, like, you know, the crowded night markets, for example? Are those things still on and happening?
Well, if you do come to Singapore at the moment, if you're planning your trip to Singapore, I would say to be prepared, probably for not the same experience that you might have been used to. So at the moment, you can only hang out in groups of 2 people. If you want to drink after 10:30, forget about it, I'm afraid, because bars and restaurants aren't allowed to serve alcohol at 10:30, so most of them close anyway. There isn't really many big events on at the moment, certainly no nightlife at all. But one does imagine that now with reopening the borders to the world, they're going to have to start looking at ways to reopen up internally as well. I know that a lot of the hospitality and tourism industry here have really struggled. A lot of the hotels have actually just been kept afloat by hotel quarantine, but some of them are beginning to wind down now and will be preparing to take on tourists. So it's still very much the same tourist attractions that some Australians may have been used to are still here. But at the moment, it's a little bit more of a subdued Singapore than some might remember.
It'd still be good to get there, that's for sure. Adam Hancock, appreciate
Absolutely.
you giving us a bit of a snapshot of life in Singapore at the moment. Thanks so much for your time.
Thanks.